Hey, what is up, y'all? It's Sonia,
It's Genevieve.
And Teresa.
bringing you fresh and zesty content for your education and enjoyment.
In this episode, we're going to talk about the recent COVID-19 order for the state of Michigan as well as its impact on businesses.
All right, so we can get into the number of cases as of November 21st, which are... Teresa, what's that number?
328,178 cases with a total of 8,874 deaths and about 152,267 recovered, and that's from the New York Times website, that interactive website, which I find is pretty cool.
Oh, cool. What is on that website that you think is really cool?
I think the fact that we can really sort through states, counties, and then, we can see different trends and the different ways that they organize and aggregate the data. I find that's pretty useful. So speaking for the state of Michigan, the overall trend of daily cases was at the lowest around mid-June, but ever since then, daily cases have been rising, and we've been setting really big records in recent weeks with, November 16th, there's about 12,763, and that's daily cases. So that, yeah, there are, it just, goes to show there's a big need for some, I guess, regulation, and that's where the Michigan Department of Health and Human Services comes in with this new COVID order.
I mean, we kind of expected that, though, with just everybody kind of knowing that a second wave would hit. So I don't know if anybody was surprised by the fact that we're kind of shutting down again, but I think the reaction to it is really what's interesting. Does anybody have the order on hand of, what the specific official statement was?
Yes. So, this order is actually issued by the Department of Health and Human Services and not Governor Whitmer, which I find to be a little bit notable because throughout these past months, it's been Whitmer who's been ordering at, from what I've seen on the Michigan.gov site, over hundreds of orders, many of which have been rescinded, due in part by the Michigan Supreme Court. So I think the fact that this one is, the separate department, that's kind of notable. And this order, it limits, its aim is to target social gathering group activities. It's not so much as a blanket stay-at-home order like we had back in March. This one's 3 weeks, and it limits residential and non-residential gatherings. So no in-person school for high school, so 9th and 12th grade. But essentially any job that cannot be performed at home, like manufacturing and production, you can still do that. There are personal care services available, gyms with regulations, salons, tattoo parlors, but indoor dining is one of the most notable, prohibitations. So, yeah.
Yeah, outdoor dining and takeout are allowed, but restaurants that have indoor dining, they can't utilize that.
Right.
Right, okay.
I find that funny, the outdoor dining, because we're getting November here, it is snowing as we are talking, so it's understandable to where people would be upset about the whole indoor dining thing. But,
right.
I wanted to specify with the gyms and stuff as well. It was said that specifically individual training is allowed, but any group sports or group training sessions would not be allowed.
Right.
Yeah. Oh, speaking of restaurants, was it Michigan's Lodging Association, or what's the name?
Yes, Michigan Restaurant and Lodgings Association, and there was a recent controversy with the lawsuit, and we'll get right to that after. I guess I want to bring up the whole points with restaurants and businesses first. So Jenna, I know you've mentioned before that you out of the three of us, you have been still relatively more active. So what things have you seen in regards to restaurants and COVID orders before this new order?
we got the dog going. But yeah, no, I probably have been the most active with restaurants and stuff. I know my family's gone out a couple times between shutdowns and everything. And I know I've been to a couple of steakhouses. I've been just a couple family diners as well. There's some places that have a really good setup of social distancing and making sure that people are kept apart from each other and that things are cleaned after. And then there's some places that it's much harder to do that with. I know, especially some of the steakhouses, because they're already like larger businesses and have so much going on that it's hard for them to regulate that to such a small area. It's also the ones I go to are much closer together in terms of where everything sits. So it's difficult for them to begin with, but I feel like they could be following it a little bit better. Whereas I know some other places really put in the effort to make sure that everything was followed.
Right. So would you say that, given we have 6-7 months before since March, and between that time and now, which the order is right now in effect, would you say to those restaurants that are unable to adapt, is there some way to circumvent that? I guess my question is it fair for these restaurants who cannot adapt, to be put into, for lack of a better word, targeted by this new order, I guess?
I know specifically some of the restaurants have been doing a lot of carry-out because of that. Well, I think they would just have to come up with a way to adapt to these new orders if another one was to be put out about reopening those restaurants, but in a safer manner. Because I know there are restaurants that have been able to, hopefully, to the best capacity, be able to open safely. And I think the people that are most at risk are the waitresses and the waiters that work at these restaurants, and less about the customers themselves. Because I know I've had restaurants where I don't know of any customers that have gotten it, but when the staff do get sick, they have to shut down for a couple of weeks because of that. And so I think it's the best way to do it would be to find a way to keep the waitresses and wait staff safe. That seems to be the biggest issue that I've seen. But normally, if the businesses that are being safer are able to open, they'll normally open the ones that aren't being as safe, just because there's not a really good way to regulate that in terms of who is being safe and who isn't without manual inspection.
Right. So, Sonia, what are your thoughts?
I mean, okay. I definitely know that Genevieve's going to disagree with me on this, but for the restaurants in general, the entire COVID pandemic started in March, right? And that's 8 months ago. So I feel like during that time, they could have figured out, if they only had indoor dining, they could have figured out a takeout system or a carry-out system in general. They had so much time, and I feel like, why are they now the fact that they're now kicking up a fuss after so much time that they had to get their lives together, I guess, and get their business in order. I don't know, I just feel like this is unnecessary, and I'm just mad that they had so much time to fix things, and now they didn't, so now they're causing an issue for everyone else and, suing people that don't need to be sued in the first place.
Right, yeah. I mean...
Are you talking about the restaurant owners themselves? Or the businesses, the restaurant businesses?
Well, I think what she's referencing is that, I mentioned the lawsuit from the Michigan Restaurant Lodging Association, and one of their claims is it's hard for restaurants at this time, and, for us to adapt, it takes time. And I guess her counterpoint is that, that claim that adaptability isn't necessarily possible at this time is, I guess, lack of a better word, invalidated, because you've had so much time from March till now to adapt and develop carry-out systems or some alternate way to continue your business. So the fact that, you bring up adaptability isn't necessarily, I wouldn't say valid, but a great point.
And I would just like to counter with this. I think you bring up a really good point about the fact that they should be ready for this. But you can also bring that point to other businesses, like schools, for example. I know that's not a business, but schools. The entire spring season that got shut down for schools, they were very much scattered and didn't know what to do, which I know businesses are the same way, and they had to adapt to that, and they did, and most of them did. But the only issue is, I would say that the businesses also adapt. Most of them did come up with a takeout plan, a way to still be doing takeout food or delivery to maintain that business. But the only issue is, I was in an NHS meeting the other day, and they're looking to help tutor freshmen, because I don't remember the exact percentage, but it was at least a quarter of the freshmen are failing classes, or maybe it was like 10%, but that's still a large number of a class of kids failing classes because they're online or they're not paying attention. You know what I mean? And so to say that if you compare, most restaurants make their money from dine-in eating, right?
Yes.
So when you take that aspect away, it makes it very difficult for the restaurants to stay in business and to make a profit. And so I would say the same thing for schools in terms of they're trying to come up with a way to get kids to pass their classes, because when they're not used to this and they're struggling to learn online, it's also the issue of, yes, there's this new situation that they have adapted to and they're trying to implement, but sometimes it's just not enough to be productive. And so I do agree that it would be safer, and they need to figure out a way to safely and most effectively adapt to a takeout system, but sometimes it's just not enough at this current moment in time.
Oh yeah, I forgot about like the failing freshman thing, because he's our band teacher, he brought up how this was like the first year where a lot of kids were actually failing band, because it's like impossible to fail band. You just play the stuff, turn it in, and then there you go, you get the points. But like, because like people aren't wanting to turn things in, or they just straight up forget, they get failing grades, and Mr. I's kind of scared about it.
Yeah, exactly. So it's not really so much as adaptability, but also sustainability, and how well you're able to maintain that sort of, I guess, level of profit while, still adhering to guidelines.
Yep, and that's exactly what I'm saying about restaurants, is they have that adaptability, but the sustain for keeping a profit going and making sure they can stay in business during the time is probably why most of them are upset about the lack of dine-in. Do you want to talk about the lawsuit now? I think we've rounded enough of it out to actually discuss the full plan here.
All right, so the Michigan Restaurants Lodging Association is, they're filing a lawsuit against this order. And, most of their reasonings can be summed up by, again, the whole restaurants, and they're being targeted. And many of them have, they claim allegedly that many of their restaurants are adhering to proper guidelines, and they have proven themselves to be capable of doing so, and, minimizing the spread. And actually, they cite that they have the government themselves, the Michigan Department of Health and Human Services, has cited that the percentage of COVID, outbreaks from restaurants, or were indirectly caused by restaurants, were actually one of the lowest. So they are angered right now because, what's the point of targeting dine-in restaurants if we are the lowest percentage, and again, it's sort of counterintuitive. And they also bring up the fact that restaurants are now struggling and layoffs are imminent, especially with this upcoming holiday season, as well as the impartial treatment with this order, because as I mentioned before, this order allows personal care services, tattoo parlors, and salons to be open, but restaurants, they're still targeted. Whereas before, with the whole blanket statement order, essentially everything was shut down. So now they're saying, well, what is necessarily the difference between these personal care services and us, I guess. So what are your thoughts?
I would say I understand both sides of this coin in terms of being targeted when you don't feel like you're the main problem here. Because I know for when they shut down fall sports for our district, and cross country was one of the ones that went, we felt like it wasn't fair to us, being that we are very much following guidelines, and we're a running sport. We're not, no contact, very little of being around each other without masks, almost ever. And so I understand what it feels like to be targeted against when you feel like it isn't fair to you trying to accomplish something. But I also know when it comes to trying to limit the number of cases, I guess you could compare this to greenhouse gases and trying to make sure that we are limiting the amount of greenhouse gases in the atmosphere. And this is very off topic, but I swear I have a point here. We like to, I don't know which one specifically, but it might be meat production and stuff that people are very much against, saying that we need to cut down the amount of meat humans consume because it's a really big factor for why there's so much greenhouse gases in the atmosphere. But people say that it's actually a very small factor of that, and most of it comes from cars or other mining businesses and stuff. And so when you look at it, yes, it would still be good to cut down on the amount of meat because you don't want to be having any sort of addition to that, but also the fact that it's not the largest problem and you have other issues that might be bigger to deal with. And so as I feel like it isn't completely out of the question for them to shut down businesses and restaurants because of the fact that they are some small percentage, but I agree that some of that energy that could be used to shut down those kind of things could go into other places where we locate that there is a bigger spread. How to do that, I would have no clue, but I feel like some of those resources could go to trying to figure out where the largest spread is from.
Right, and it's not only about, I guess, preventing spread, but also like the aftermath. You know, I guess morally, of course, in an ideal world, I would love to shut everything down if there was no economic or social or other negative impact. But I mean, in the lawsuit, it even says, in spite of serving millions of Michiganders each day, there are only 5 investigations statewide involving a restaurant patron, and the Michigan Department of Health and Human Services itself attributes to only about 4.4% of outbreaks to restaurant. But with this order, it is likely that more than 40% of restaurants are now likely to close, at least temporarily, and 250,000 employees are likely to be laid off. So I guess this also brings up moral versus the whole, I guess, the moral aspect of, hey, if I can shut everything down, I would. But reality is you can't do that without massive repercussions. So there is an essential value placed on people's health and lives over, I guess, the economy, and where we draw the line of preventative measures and how that may impact people's livelihoods and economic and social impact. So, Sonia, what are your thoughts?
Yeah, you said it perfectly. Like, in an ideal world, we would just lock everything down and protect everyone just so we can move on with our lives and have this whole virus behind us. But the fact that everyone is losing, not everyone, but a whole bunch of people are losing their jobs or getting laid off, or their paycheck isn't as big as it used to be because of the virus, and Whitmer's obviously doing what she thinks is the best, and some of it seems to be working, some of it doesn't, and there's a whole bunch of different reactions to it. So I guess things to think about, or the takeaway of this is, like, how will this affect legal precedents in the future? How do we learn from this economically and socially? Did we even adapt well as a society because drastic changes were made? And how will this affect future generations?
Right, and when you bring up legal precedents, I also want to make a note. I hit on the point earlier where this order was from the Michigan Department of Health and Human Services, and not Whitmer, which is, again, notable because even though the Supreme Court has sort of ruled against her actions and her use of powers as the governor, again, many people claim, including this lawsuit, they claim that now she's kind of circumventing that order by going to the Michigan Department of Health and Human Services and having them issue orders, which they actually have the power to do so under Michigan Compiled Law 333.2253, provides that if the director determines that control of an epidemic is necessary to protect public health, the director, by emergency order, may prohibit the gathering of people for any purpose and may establish procedures to be followed during the epidemic to ensure continuation of public health services. So, again, there is a very heavy legal implication. If something should happen again like this in the future, knock on wood, but how will this be handled in the future? And how, I guess the giant takeaway is, how will we take this? Because again, honestly, we're all kind of learning as we go. New information is coming out every single day, and it's just really about adaptability and sustainability, like Jenna said. So, yeah, on that note, thank you for listening in to our very first episode. We are super excited for what we have in store. Stay tuned for more socially and politically related content, and comment down below. What are your thoughts? Do you know anyone that will be directly affected by this new order? And if so, how have they reacted or adapted to the pandemic as a whole?
As well as that, I would like to give a shout out to Teresa for a little bit for doing most of the research on this episode. Some of it Sonia as well. And we will respond to comments if you leave them, as well as thank you for listening. And I think that's all I have. If you have anything to add, Sonia.
Yep, for our listeners out there, be sure to let us know what other new ideas or topics you want to see on this show. And thank you for hanging out with us, and be on the lookout for our next episode later this week.